Hi, this is Dr. Milescu. I'm an adjunct professor at Daytona State College, DeLand campus. I teach anatomy and physiology lab as well as human biology lecture. In my spare time, if I have any, I see private clients. I'm a health and wellness professional as well. I have a practice that involves people that have healed from surgeries and have chronic injuries. I've had physical therapy, it ran out. They want to continue to be fit and healthy. So I provide medical yoga services, therapeutic Pilates, as well as energy healing services. So all of that you can check out at milescumedicalyoga.com, or you can go to my yoga studio website, serenitynowyogacorp.com. And of course, along the way, if you subscribe to my channel, you'll see quite a few exercises that were Pilates based, some yoga based, and you will see quite a few videos that will highlight all the weeks of me teaching anatomy. I am now week 10, so this video is for my students and any students around the world trying to understand and comprehend the complexities of anatomy and physiology. So this semester it's AMP1, and we have gotten to week 10 where we are going over muscles. Last week, I want to finish off last week, we went over microanatomy of the muscles. And we had 2 lab models, and I want to go over the third before we enter the realm of learning all the muscles that are highlighted on this handout. You're lucky, you only have to learn a few that are on the handout. We handpicked the most important ones to highlight muscles. Obviously, that's still very lengthy. This video is not going to be short. But there are over 600 muscles that will be not included in this video. So please do not think that this lab video is going to cover all muscles. It is only the muscles that you will experience and have to acquire knowledge of for your practical and for your quiz next week. And basically, I'm going literally by the outline. So the muscles on the outline you should definitely know. All right, so before I start all that, let's look at this one model before we finish and finally close the book on microanatomy of muscle. So prior to doing this video, last week we showed you the neuromuscular junction, described the action potential, events at the neuromuscular junction, excitation, contraction, coupling, and the cross-bridge cycle, which finally leads to muscle contraction. Well, this is stage 2 here. This is phase 2. You can see excitation, contraction, coupling here, because this is the sarcoplasmic reticulum. These here are the T-tubules. And then if you look really close here, you can see the thick and the thin filaments, the cross-bridge cycle. That's a Z-disc. So definitely make sure you take a look at this, study it. It will be on your practical. All right, so I'm not going to go over any more of that. We're going to start the muscles. The first muscle I'm going to start with is frontalis. It is on your handout. Make sure you really take a look at your book, study from it, bring it to lab. I highly recommend, if you're not in my lab, this anatomy lab manual is excellent. If you're doing muscles, you must have visual. My lab models that I'm showing you right now is not enough. You need to look at lots and lots of drawings. No pun intended, maybe Gray's Anatomy manual might help, but it's a little bit too in-depth for what we are learning here. So that is why I recommend 13th edition, Human Anatomy and Physiology Laboratory Manual by Marieb and Smith. Everything begins on page 200. So on page 200, you can see this frontal bone. And the frontal bone has the muscle called frontalis. How simple, right? Over on top here, you have the aponeurosis. So the origin is the aponeurosis. The aponeurosis is connective tissue, very similar to tendon. Of course, it has collagen, it's strong. But instead of tendons where it kind of becomes in one spot, small surface area, this is a very large surface area. Definitely weaker than what a tendon would be. All right, so origin is aponeurosis. Insertion is over the eyebrows. So this is the frontalis muscle. What does it do? Well, I just moved my eyebrows. So that's what it does. It moves your eyebrows. Hope I made you laugh. All right, so we went over frontalis. The next one is temporalis. That's the one I'm going to go over now. So temporalis is on the temporal bone. How simple. We picked some muscles that are quite simple, not too difficult. There's your temporalis. Again, this spans a very large surface area of the temporal bone. So of course the origin is temporal fossa, and you can also see it in your lab manual. There it is. Okay, and if you look at it, temporalis is a fan-shaped muscle. Origin is temporal fossa. The insertion is coronoid process of the mandible. If you remember your bones, where the mandible is, right here, that was the angle. You had the ramus, and then you had the two bony landmarks. One was the TMJ, and then of course this here, the coronoid process. Okay, so what does this do? This muscle right here is going to help close your jaw. So if you put your hand on the temporal region, open and close your jaw, and you can feel that muscle contracting. All right, so far we've done 2 muscles, only 2. Quite a few to go. This is not going to be a short video, so bear with me. I'm going to try to be as succinct as possible. Easy peasy, short and sweet. Next one, masseter. So masseter, you can see right here. There's the masseter. And let's see, masseter is also found on page 200. As you can see right there, there's your masseter. And, whoops, right there, sorry. There's the masseter, okay? And the masseter muscle is also a muscle that's going to help you close your jaw. All right, so let's go over the masseter muscle. Jaw closure is the action, but let me go over origin and insertion. Origin, please put zygomatic arch. You can put that on an index card, OIA, that's how you memorize this and put it to long-term memory. I highly suggest that you get index cards. In the front, you name the muscle. And then for practice, you try to acquire it from memory. If you forget, you flip it over and you have your answer, OIA. Now, in your handout, the ones that are with an asterisk, you definitely have to know OIA. Most of the other muscles, you should just kind of know O and I, so origin and insertion, but you should all of the muscles that are on this list, you should know their actions. Okay, so where were we? We did temporalis, we did frontalis. Now we talk about the masseter. So the masseter, the origin is zygomatic arch on the zygomatic bone. And then ramus, angle right there, ramus and angle right there of the zygomatic, of the mandible. So again, to review, zygomatic arch, and then ramus of mandible, and is jaw closure. Okay, so one more time so you can see it for your practical and next week's quiz. I'm going to point to that. We can put a sticker on it right there, and that is your masseter muscle. Okay, so we went over 3 muscles. I'll keep doing this because otherwise you'll forget. So we did frontalis, we did temporalis, and we did masseter muscle. Okay, next on your list is orbicularis oculi. So orb means circle, okay, in Latin, and oculi means eye. So that's pretty easy. It's a circular muscle around the eye, translation. So there it is, orbicularis oculi, orbicularis oculi. All right, so what of this muscle? It helps you close your eyelids, okay? So that's the action, closing the eyelids. Now, in your book, I'm always going to go back to that because this way when you're watching this video, you could also refer to the lab book, right? That's pretty important. So in the lab book, it's on page 199. And then the chart that shows you origin, insertion, and action is on page 198. So again, I highly encourage that each muscle that I go over right now in this video, you put on an index card, okay? So orbicularis oculi. According to the book, it says frontal and maxillary bone. It also says ligaments around orbit. So we're gonna keep it simple. Just put, for origin, frontal / maxillary bone, and then the insertion is on the eyelid, okay? Insertion is eyelid. And then for action, just put simple, close eye, okay? So that's orbicularis oculi. All right, so now let's continue on. Next one on your list is orbicularis oris. Orbicularis oris. So let's go over on the model where this is. Right here you can see orbicularis oris. Orbicularis oris. It's a circular muscle around the lips. All right, very special muscle, helps you kiss. And it is also a muscle that helps you whistle. And so that is the action of it. But let's go over the details, shall we? So the details of orbicularis oris. Origin, according to the book, it has quite a few origins, all right? So we're gonna keep it simple. The book says indirectly from the maxilla and the mandible, fibers blended with fibers of other muscles, blah, blah, blah. So what are you gonna say? Keep it simple, put it on an index card, maxilla, mandible, and then insertion is corner of mouth, okay? Insertion is corner of mouth. And then what you're gonna say for action, put closed lip, and then parentheses, kissing and whistling. All right, so guess what? We are done with the face and going on to the neck. Obviously, there's so many more muscles that we are not gonna go over in this video and is not on the handout, nor on the quiz next week or the practical. But please make sure you understand that, because this is not the end all of anatomy. When you get into professional school, definitely go into way more detail than A&P 1. Okay, let's begin now with a very important main muscle. Massage therapists will like to, grab that strap-like muscle along the neck right here. It helps you do lateral flexion and forward flexion. It is called sternocleidomastoid. Now, the name itself basically gives you a hint as to where the origin is, where the insertion is, okay, and what it does. So let's go over it. Sterno, because guess what? The origin is the sternum. Cleido, because some of the origin, the second, there's two heads. The second head is from the clavicle, and cleido is Latin for clavicle. And the insertion is the mastoid process behind the ear, that bony prominence in the skull, posterior to the external acoustic meatus, which of course you know because you did so well on the midterm practical regarding the bones, right? Okay, so let's go over sternocleidomastoid. I waste a little time in this video looking for the page, but I have to because I really want you to go over it in the book. So in the lab book, the sternocleidomastoid is found on page 202 at the top. And you also want to take a look at page 201, which shows you the two bellies. So you have one belly that is going to attach to the sternum. And then the other belly right there is going to attach to the clavicle. So let's look at the model, shall we? So please don't get confused when you look at the model. This is a first layer muscle. We are going to learn a second layer muscle deep to sternocleidomastoid. So that's sternocleidomastoid. Deep to it are three other muscles which we're going to go over: anterior, middle, and posterior scalene. For now, let's look at sternocleidomastoid. It looks like it had a piece of tape on it, probably from the previous practical. All right, so do you see that there's two bellies, 1 and 2? Okay, so that's 2 and that's 1 right here. Okay, so this long strap-like muscle, sternocleidomastoid, do you see it? And look at that, look at that. It's going to attach, the insertion is going to attach along the mastoid process. All right, now just remember, this is quite important. All muscles, generally speaking, let's think about the bicep muscle. The origin is not movable, okay? It is stationary, it is attached, and that's it, doesn't move. Unless it's injured and you tore it up. And then the insertion distally is movable, it moves, okay? Certain muscles, it's opposite, but most muscles, you have the origin proximal and the insertion distal. In this case, it's reverse. Check it out. Sternocleidomastoid likes to be different. The origin is distal and the insertion is proximal. Therefore, the insertion moves, so therefore you can move your neck, thankfully, right? So sternocleidomastoid attaches to the mastoid process to help you move your neck. Why? Well, proximally, it's stationary. It is way attached. It's attached to the clavicle and the sternum. All right, so let's go over it in your book. The origin, as I said, let's find sternocleidomastoid. In your book, in the chart, it'll give you a long description. Manubrium of sternum and medial portion of clavicle. All right, shorten it, short and sweet, so you remember. I would say clavicle and manubrium. Hopefully you remember that manubrium is the superior portion of the entire sternum. It was manubrium, sternum, and xiphoid process, right? Because you learned bones so well, and you did so well on that practical. All right, so notice it's layered learning. If you learned your bones, this is easy. Know your bony landmarks. Origins and insertions attached to bony landmarks. Ergo, sternocleidomastoid. Okay, so that's the origin, okay? Manubrium and clavicle is the origin. Insertion, mastoid process. Action. Now, the book is very verbose. Simultaneous contraction of both muscles, meaning both muscle bellies of pairs, causes flexion of the neck. So in other words, you got two muscle bellies. When you flex your neck, both of them work, okay? Now, if you're doing rotation towards the shoulder, then it's one muscle acting independently, okay? So both sternocleidomastoids on both sides will help you for forward flexion. Lateral flexion, it's the side in which you're taking the ear to the, so in this case it's left ear to left shoulder, my right ear to the right shoulder. That's the sternocleidomastoid that's contracting. And that's the sternocleidomastoid. What are you going to say? SCM, for that muscle to keep it short. All right, done with that, we move on to the scalenes. So the scalenes are deep. You've got sternocleidomastoid right here, and deep to it, on this side, you see the deeper muscles. This is the superficial muscle, sternocleidomastoid. Deep to it, you can see here the three sisters. Anterior scalene, middle scalene, posterior scalene. Anterior scalene, middle scalene, posterior scalene. Okay? In your book, you can see it on page 202. Anterior, middle, and posterior scalene. All right, what do you need to know? Basically, the origin is going to be the cervical vertebrae, specifically the transverse processes. So please put for origin, transverse process, cervical vertebrae. Insertion, put ribs 1 and 2. Action, place your hands deep on the scalenes above your clavicle, and now take a deep breath. And now big exhale. Hopefully you felt your ribs come up, ribs 1 and 2, and you felt the scalenes contract. So guess what? The scalenes are involved in inspiration, or layman term, inhalation. So when you inhale deeply, your scalenes contract. So scalenes are involved in inspiration. What else would I add? It will also be a synergist with SCM because it'll flex and slightly rotate neck. All right, guess what? We are done with the neck. We move on to the second page, which is pectoralis major. In this video and in this lab, you do not have to know pectoralis minor. So let's turn to the lab page for pectoralis major. That would be page 202. Here it is, pectoralis major. Okay, can't miss it. Everybody knows about it. Everybody wants good pecs. And if you're in the gym, you're working on this exercise on that machine. And guess what you're doing? You're adducting. So I'm jumping ahead. Let's go ahead and talk about this muscle. So origin. I'm going to show you Mr. Trunk here, this trunk model. He's quite big. There it is. And you can look at, you can see it spans a very wide area. You could see the entire sternum. And it's going to go to the intertubercular groove of the humerus. So I'm going to pull that out just to kind of, I got a bag of bones here, just to review from pre-midterm the humerus, voila. And if you look at pectoralis, the intertubercular groove or sulcus is right here. That's going to be the insertion. Okay, so you have the greater tubercle, lesser tubercle, greater, lesser tubercle, intertubercular groove. Okay, that's going to be the insertion site. What's the origin? Well, you saw it's pretty much all of the ribs, so let's go over it. It's going to span not only the sternum and the ribs, it's also going to span the clavicle. So for origin, you're going to put clavicle, sternum, ribs 1 to 6. That's origin. Insertion, intertubercular sulcus. Prime mover of arm flexion and adduction. So if you're doing push-ups, okay, it's also flexion. So you're going to feel it, right? You're not just going to feel your arms when you're doing push-ups. So it's flexion and adduction. So remember that. It's flexion and adduction as well as medial rotation. So if this is supination, that's your supinated hand, medial rotation, you're still going to feel it in your pectoralis major. All right? So adduction, flexion, medial rotation, all regarding the arm. So prime mover of arm flexion, adduction, and medial rotation. So put prime mover of adduction, flexion, medial rotation. All right, that is pectoralis. On your list, it is asterisk, which means you absolutely have to know all of it. Origin, insertion, action. And I just went over it, so hopefully that helps. You know what it looks like. I have my little man over here as well. There's your pectoralis major. We would put a sticker on there, ask you, what muscle is that? And then remember, your practical is multiple choice, so the answer choices are there for origin and insertion. But you must learn the muscles, commit to memory, origin and insertion, action. If it is in asterisk, it is definitely on the practical to know all of it, not just parts of it, okay? All right, so the next one is serratus anterior, a little bit more difficult to demonstrate on the models, but I will show you. They are back here, right there, serratus anterior, right in there, okay? Serratus anterior. They are your rib muscles. So if you like eating prime rib, besides the intercostal muscles, you'll have serratus anterior there. So in your book, please do not confuse pectoralis minor. Let's see, let's show you. Pectoralis minor versus serratus anterior. Okay, pec minor, serratus anterior. Okay, don't get those confused because they're like very similar, but the fibers are not going in the same direction. All right, so what of this serratus anterior? Let's go over origin, insertion. Again, this is not an asterisk. I'm just going to give you the information so you generally know, but you should definitely know what the action is. So ribs 1 to 8 is serratus anterior, and then please put scapula. The book is going to say vertebral border, anterior surface of scapula. For the purposes of being succinct and being able to commit it to memory long term, just say scapula, okay? And then, of course, everything about the scapula is what the serratus does. So it's prime mover to protract and hold the scapula against the chest wall. You've seen people where the scapula flares out. So there's some weaknesses in the muscles there. And it also rotates the scapula. Scapular rotation. All right, so that is serratus anterior. Now for the fun muscles of the abs, because who doesn't want a nice pair of abs, right? The pair of muscles, there are four of them. The outermost is your six-pack, rectus abdominis. Rectus abdominis, and then beneath that is external oblique, which are on the sides. Deep to the external oblique or internal oblique, the fibers are in the opposite direction. And then deep to the internal oblique is the deepest muscle that goes transverse across the body and gets sacrificed when you have a C-section. That's called TA, or transverse abdominis. For the purposes of this lab, you only have to know rectus abdominis, external oblique, and internal oblique. On your list, external oblique is mentioned first, so let's go over that. So external oblique is going to help you twist your trunk, Russian twists, any kind of crunches that involve twists, you're using the obliques. Let's go over origin, insertion, and action. If you look at the model here, you could see external oblique right in here. Okay, there it is, external oblique. In fact, in the book, okay, he fell. It's a long video. I hope I'm not boring you. Okay, external oblique in your lab book. There it is, external oblique. And then deep to that, you're gonna see internal oblique right there. And then deep to that, you're gonna see transverse abdominis. Okay, right here, rectus abdominis. Deep to that, right here, is external oblique. Deep to that, right there, is going to be internal oblique, and then straight fibers transversely across is transverse abdominis. All right, so let's go over origin, insertion, and action. Very briefly, external oblique, you're gonna see lower 8 ribs is the origin. Internal oblique, linea alba, is that white connective tissue that separates the rectus abdominis. And it goes deep to that. So that is a connective tissue. Pubic crest, if you remember, let me grab a hip bone. So if you remember your hip bone, and this is your pubic bone in the front, there's your iliac crest, that's your ischial tuberosity. So right here, if you look right here, you can see that pubic crest, all right? So part of the whole learning process is that the external oblique, the origin is linea alba, pubic crest, and pubic tubercle, which is the little bump. And then, of course, the iliac crest, which you learned so well when you did bones. There's your iliac crest, okay? Don't forget, pubic crest, pubic tubercle, so that's the crest, pubic tubercle, and then iliac crest. All right, so those areas are all the parts that are involved in being the origin. Okay, let's go over now insertion. So insertion is going to be, oh, that was the insertion. I'm getting tired. Lower 8 ribs was origin. Insertion was linea alba, pubic crest, pubic tubercle, and iliac crest. All right, regarding the movement or action, I would say put lateral flexion because you're working the obliques. Lateral flexion, flexion of the trunk. And when you're doing curls and twists, you're using the obliques. So that's how you remember. Lateral flexion and flexion of trunk, okay? So that's external oblique. Guess what? Internal oblique does the same thing. So internal oblique, unlike external oblique, the origin is not going to be the linea alba, the pubic crest, and pubic tubercle. It's going to be more coming from the back, the lumbar fascia. So origin is going to be the lumbar fascia. It is going to be the iliac crest, as well as the inguinal ligament, which I will show you. You don't have to really go into too much detail on this for your test, but there it is. That's the inguinal ligament, okay? So that is basically what you need to know for origin of the internal oblique. Now, internal oblique insertion is going to be pretty much exactly the same as external oblique. The only exception is that it runs a little bit higher and it goes up to the ribs. So again, just like external oblique, it's going to be linea alba. It's going to be pubic crest. But unlike the external oblique, it's really not going to the iliac crest. It's going to be the last three ribs. All right? Action is the same as the internal oblique. It's going to include trunk flexion and lateral flexion. So again, remember, if you're doing curls, Russian twists, anything that involves exercising the core, you'll remember you're working the obliques. Any kind of exercise where you're lifting up and working those obliques, it's lateral flexion. So I incorporate exercises because it gives you visual and helps you remember the actions of these muscles, and I hope that does help. All right, now the famous rectus abdominis is the six-pack. I don't think I need to show you that one because you pretty much have seen it. Here it is, rectus abdominis. Okay, that's with the aponeurosis over it. All right, so rectus abdominis is your sit-up muscle. It helps you curl. So it flexes the trunk. Let's go over origin. Well, origin, believe it or not, is distal, and then insertion is proximal, kind of like the sternocleidomastoid. Unlike other muscles like in the arm or lower extremity where origin is proximal and insertion is distal. In this case, origin is distal and insertion is proximal. So let's go over rectus abdominis. So origin is pubic, crest, and sympiphysis. So where's my hip bone? So back to pubic crest, and pubic sympiphysis is the fibrocartilage between the two hip bones. That's going to be the issue, obviously, when it's labor and delivery. So this muscle, along with external and internal oblique, are going to be compromised during labor and delivery, especially if you have a C-section, the TA is cut. All right, so pubic crest and sympiphysis is the origin. Insertion is xiphoid process. You all know that. Hopefully you learned about the sternum. Xiphoid process and ribs 5 to 7. And what is it going to do? It's going to flex the trunk, flex that vertebral column. It's also going to rotate your trunk along with the obliques. All right? So rotates the trunk, flexes the trunk. And that's pretty much it with respect to the muscles of the abdomen. Yay! We're getting closer and closer. We're getting to the back and buttocks, then upper limb, lower limb, and we're done, which is probably another half hour. So I think what I'm going to do is end here and start up the second half because the video is going to be too long and it's going to be impossible to upload to YouTube. So bye. I hope you enjoyed this video and I'll see you for part B.